And, you know, every time you go to the doctor, your safety is actually in the hands of your state's medical board. It's the agency charged with stopping dangerous physicians from practicing. And there are concerns this morning that medical boards across the country are failing their primary mission to protect the public. Mark Strassman is here and has been looking into this. Mark, good morning.
Good morning, Nora. We started by looking state by state at medical malpractice payouts. That is, when insurance companies settle with patients who sue doctors. Now, even the best doctors can get sued, but some doctors settle cases far more often than most, even within the same specialty. We found a troubling trend in Florida. Doctors who have the most malpractice payouts seem to keep practicing until retirement because the state's medical board lets them, even when patients are seriously hurt during their care or die.
She was someone that you wanted to be around. Always positive, always uplifting.
James Dunphy met his wife Susie in college. They both became doctors, got married, and had 2 sons. But on a family trip to Florida in 2009, Susie Dunphy was diagnosed with appendicitis. She had emergency surgery, and 2 days later, the 42-year-old bled to death in her hospital bed.
How do you explain to 2 small boys that?
I told them that mom's sickness was just too much, and that she died. But I told them it would be okay, and that I would be their mom and dad now.
In the weeks after her death, James Dunphy reviewed his wife's medical file. What he read convinced him that her doctor could have prevented her death. That doctor was Ernest Renke, a general surgeon in St. Petersburg.
Helping our patients reach their goals is important to us.
Dr. Renke comes in at 8 a.m. the next day. Does he do everything that you'd expect him to do?
At that point, her pressure had now been critically low for hours. There was no orders for any lab tests. There was no orders for any kind of imaging studies.
You're a physician. How basic is that?
These are the kind of vitals that anybody with basic training can recognize as abnormal.
Dunphy sued Dr. Renke, blaming him in part for his wife's death. Dr. Renke denied wrongdoing in a deposition.
You feel you did everything you should have done?
I did.
But his insurance company settled the case for $250,000, the most it could pay. We analyzed Florida records and found Dr. Renke has had 11 medical malpractice lawsuit payouts since 2000, tied for the most of any practicing physician in the state. Yet the Florida Board of Medicine has never restricted his license. That caught our attention. So we looked at the 25 doctors with the most malpractice payouts in the state. Not one of them was stopped from practicing solely for providing poor medical care.
When you look at these doctors with the largest number of malpractice suits, you have to ask the question, at what point could we have prevented the last 5 or the last 10?
Dr. Sidney Wolf of the watchdog group Public Citizen has published studies on state medical boards nationwide. He says many of them are failing to protect patients. His latest report found that from 1990 to 2009, more than half the doctors in the U.S. who had their privileges restricted or revoked by a hospital had never even been fined by their state medical board. And he says hospitals generally only go after the most dangerous physicians. Public Citizen has also ranked medical boards based on the number of actions taken per physician in their state. Those with the most, Ohio, Oklahoma, and Alaska. Those with the least, South Carolina, Minnesota, Wisconsin, and Florida.
They keep practicing, keep injuring or killing people, and malpractice suits occur.
About a year after Susie Dunphy's death, James Dunphy received this letter in the mail from the Florida Board of Medicine. It had investigated his wife's case and found no basis to file a complaint against Dr. Renke.
I thought it was unbelievable. I teach medical students. This is something so basic, I would expect my medical students to recognize that this is not normal.
And for someone to review that case and not see the issues for what they were.
It makes me wonder if they even reviewed the case.
All in favor, say aye.
The Florida Board of Medicine declined our repeated requests for an interview. Last month, we even went to the agency's public meeting in Orlando, but no one would agree to talk with us. In a statement, a spokesperson wrote, "We must follow the due process of law in order to ensure the rights and entitlements of all parties to any action. the department is diligent in its efforts to ensure the public is protected from unsafe or unscrupulous healthcare practice.
Has been out there.
Dr. Renke also would not give us an interview or even a statement about his history of malpractice payouts or the death of Susie Dunphy.
There's really no reason for them not to be able to go to the mother-son dance. There's really no reason that, Mother's Day, that they aren't giving mom breakfast in bed. This could have been prevented.
It's heartbreaking, Mark.
Yeah.
And the fact that Dr. Dunphy is a doctor, to me, gives it even more credibility because he knows exactly what he's talking about.
I know what to look for.
And Dr. Renke is still practicing.
He's still practicing.
So who oversees these medical boards?
Well, the short answer is elected officials, state legislatures, and governors. In Florida, there's a state senator named Jeremy Ring. He's chairman of the Government Oversight Committee, and he says, based on our reporting, he's going to introduce legislation to improve the ability of the boards to protect patients.
Should there be a national database?
There is one. U.S. Department of Health and Human Services has one. It's not public, but medical boards have access to it. Problem is they don't always look at it according to Public Citizen.
Thanks, Mark.